I would expect probably the best thing is improving access to care. Um, Even among adolescents in general, we see the data sort of suggests that those follow-up rates are relatively low. Um, and that, but definitely more exacerbated among those with certain demographic factors and things like that. But it's primarily access to care and trying to get those adolescents in general for improving the booster dose. So we actually did a prior study on that shift to a single dose. And what that had showed, you would see like a drastic increase in invasive meningococcal disease in general across the population, as well as deaths. And sort of speculate, and this was highlighted sort of in this study, that a lot of that burden would be among certain demographic groups. Um, we even explored on an alternative schedule where it was like if that first dose was even pushed back to the age of 15 and a booster at 16 and 17, and even that in itself shifted the disease burden to the younger populations. So having that single dose at the age of 16 and 17, you risk a dramatic drop in herd immunity in general. It's possible that that disease burden shifts back towards the 11 or sort of that younger age group of 11 to 15, and that. And just given the extent of the dropout rate among those adolescents, you're going to not necessarily see a high level of coverage that we see with at least one dose currently with that the current two dose scheme. From the literature that I've read, and that it's just communicating the risk of meningococcal disease in general, making patients more aware of that particular risk. To me, that's sort of the biggest thing is the communication between doctor and patient. Uh, that's sort of what came across in literature. I would expect that's probably the biggest thing, and then obviously just general outreach programs in terms of that booster dose. So the first dose we see like a relatively high level of coverage. It's usually above 80%, almost 90%. And that's relatively consistent across different ethnic groups. It's primarily that second dose. And like I said before, like among many adolescents, we see a dropout rate. So it's making sure those older adolescents come in to get that booster dose to maintain a high level of coverage. So it's just maintaining that communication that you come in for the follow-up to maintain that level of protection.